Hey, what's up everybody? Josh Bennett here. In this video, we're going to talk about different types of health plans and kind of what are the pros and cons of different types of health plans. Obviously, with benefit selection season, it can be a little overwhelming when your employer basically just hands you a sheet and says, pick from one of these. And, there's just a lot of data and stats. Sometimes it can be hard to decipher, kind of what's what. And so just wanted to lend a little bit of clarity here. One of the health plans we're going to start with is an HMO. So, what is an HMO? An HMO is basically a type of plan where it's a network of providers. One of the most popular ones, or I guess one of the most well-known ones, is Kaiser out in California. So, how an HMO works is a network of participating doctors, but you have to have your primary care physician. So you have to have kind of your main go-to person. And the downside here is though, like if you need to ever see a specialist, you have to go through your primary care physician to get a referral to a specialist. So no matter what, you have your kind of gatekeeper that is your primary care physician. So that's one of the downsides of an HMO is you, no matter what, always have to go through your primary care physician. One of the upsides, however, though, is because they kind of have that system where you have to go through your primary care physician. They're able to keep their costs lower, and they just because they a lot of times will even do the insurance through the network itself, so the costs are typically significantly lower than a lot of other plans out there. So it's a big cost savings, but from a lifestyle perspective, if you want any ability to choose different specialists or kind of seek out whichever doctors that you prefer, then it may not be the best choice for you. But if if costs are a big concern, then and you not necessarily care about kind of different specialists, then it can be a really good option. And especially if you're going to have some large medical expenses coming up. So say like a birth of a child, if you you have any pre-existing conditions or anything like that you can get one of these policies through a group policy. That may be one of your better options. So the next plan is an EPO, which stands for Exclusive Provider Organizations. So the way EPO operates is it's similar to a PPO, which we're going to go over in the future, but basically it has a network of physicians that you can attend. And so you have full selection over kind of who you attend or go to in that network. You don't necessarily have to have a referral to a specialist like an HMO. You can go seek out your own specialist as long as they're in that network. The downside is they offer typically zero out-of-network coverage unless it's an emergency. So if there's a specialist that you want to go visit, say you have a specific condition that requires you to seek a certain person, certain doctor, a certain organization, well, you may be limited from doing that unless you want to pay the full freight of the costs. So if you have to go to an out-of-network institution for a non-medical emergency, a lot of times they'll cover if it's like an emergency room visit or you had to go, but they will not necessarily cover if there's not a network cost that is not deemed an emergency. So you do have to pick from the advisors or doctors in the network. Pros of an EPO is that you have the full selection of the doctors within the network. Downside is that the out-of-network costs can be substantial, but the cost compared to some other plans may be on the lower side. So they're not going to be as cheap typically as an HMO, but they're typically going to be cheaper than a PPO. So that's something to just kind of keep in mind is, it's a little better cost, but you are still restricted just from an out-of-network. So if someone having, specific doctors that you want to choose from, whether they're in network or out of network, EPO may not be the choice for you. But if you aren't particular on that standpoint, it may be a good option. So the next healthcare option is what's called a POS, or point of service plan. So point of service plan, so POS, these are a plan that kind of combine an HMO and a PPO. Again, we haven't gone over PPO yet, but so you'll kind of have to bear with me here, but it combines some of the features and benefits of those two plans. So we already went over an HMO. So how it works, it's typically a smaller network of doctors than you'll see in a PPO. But with an HMO, you still have with the POS, you still have your primary care physician, just like you do an HMO. And as long as you go to one of the doctors in that network, the costs are typically lower, like an HMO. But if you, for example, have a situation where you still have to get a referral to a specialist as well, just like an HMO, but you have the option to choose the specialist within the network. And if you go out of network, what you can do here, you can go out of network with a point at POS plan. You just may have to, actually file the claim yourself, as well as you'll have a increased cost to going out of network. But so it kind of gives you a little bit of flexibility like a PPO plan does, which we'll go over here in a second. But it also gives you some of the lower cost benefits if you're staying in that network like an HMO does. So again, you have your primary care physician, and then you have this network of doctors and specialists. So you can go to the primary care physician, get a referral to any one doctor in that network and keep your costs low. But you also have the ability to choose a specific doctor in that network, as well as even go outside. Your costs just may vary if you choose that option. So the last option we're going to go through is PPO plans. So they're preferred provider organizations. So these are basically kind of the most common in terms of health insurance plans. But basically, this is what you see where you have the ability to choose a doctor in network or out of network. So you can choose which way you go on either side. There's just going to be a different cost structure to have that choice. So you can choose any of your doctors along the way. You can get referrals from your primary care physician, but you don't have to go seek a specialist. You don't have to stay in network. Your costs will just be different. So PPO plan, the benefit of it is it offers you the most flexibility. The downside is it's typically also the highest cost. However, there are what are called high deductible health plans. So high deductible health plan can be an interesting version of a PPO if you are in a situation where you're not going to have high costs, medical costs, or I guess you assume you're not going to have it. You're healthy, you don't go to the doctor much, childbirths or medical diseases or anything like that. So high deductible plan basically means your deductible, or how much you pay out of pocket before insurance starts covering, is going to be higher, as the name suggests, than a typical PPO plan. And your max out of pocket, or the total amount you may owe, may be higher than a regular PPO. But the nice thing is the government allows what's called a HSA, or a health savings account. So the HSA is probably one of the best tax incentive accounts out there. When you contribute to an HSA, it comes out of your paycheck tax free. It grows tax free, so you can invest it like just in a normal investment account. It grows tax free, and as long as you're using it for qualified medical expenses, it stays tax free. So, wonderful tool, and this can help actually, if you're contributing to an HSA, when you factor in tax savings, can actually sometimes make it cheaper overall than a normal PPO. So it's a little bit more nuanced thinking through the high deductible plan. But if you have a situation where you don't have high medical costs that you're predicting, then it could be a really good option to explore. If you're about to have a child or things like that, or know you're going to have high medical expenses, probably not going to be the best option for you. A more traditional PPO with a low deductible and or an HMO might be a better option for you. So those are kind of the differences. So when you're thinking through what health plan to get, so the biggest considerations are, do I want a primary care physician that I have to go through, or am I okay with that? And the trade-off is, am I okay with not having flexibility, but having the lower costs for that lack of flexibility? But if you want flexibility in terms of your healthcare, then a PPO plan or some of the other plans that offer a little bit more flexibility are going to be some of the better options. So these are things just to consider as you go through kind of your benefit selection season and determine. But it's always worth looking through and seeing kind of what are the different deductibles, what are going to be your total out-of-pocket costs for the year. So if you think through, do I get tax savings with this? What's my max out-of-pocket? All those considerations are really important when you're choosing a health plan, especially like if you can't afford it, like to have a huge medical bill this year, then an HMO plan might be really enticing. If you want to take the gamble and can't afford to, have a large medical expense come your way, and that's worth it to have the flexibility of doctors for you, then a PPO plan might be better for you. hopefully you found this video valuable. And if you did, make sure you like and subscribe, because we send a lot of valuable insights and tutorials and tips and tricks and hacks to build your wealth all the time. So until next time, cheers.